Thank you so much, Dr. Kim and Dr. Wandtke, for joining us here today. To kick us off and get started on our session, why don't we start with intros? Dr. Kim, why don't you kick us off?
Sure. Hello, my name is Woojin Kim. I am one of the advisors at Within Health. I'm a radiologist with fellowship training in both musculoskeletal imaging and imaging informatics. I was a faculty member at the University of Pennsylvania, and in 2010, I started a data mining and analytics company called Wandtke Healthcare Solutions, which Nuance Communications acquired in 2016. I served as the Chief Medical Information Officer at Nuance until 2019. And in 2020, right before the pandemic, I started another company focused on data-driven intelligent resource management. I now do clinical work from time to time at the VA Palo Alto, and I'm also active in various societies in imaging informatics and work as an advisor for a number of startups.
Awesome. Thank you. I'm glad you took the time to chat with us today. Dr. Wandtke, why don't you give us your background?
Hi, I'm Dr. Ben Wandtke, and I'm a clinical advisor for Within Health. I'm the Vice Chair for Quality and Safety at the University of Rochester Medical Center and a practicing general radiologist. I've been active in the field of recommendation tracking since 2015, when I developed one of the first radiology recommendation tracking systems in the country. I've performed grant-funded research in this area, and I work closely with the American College of Radiology and other radiology quality leaders on the development of quality metrics around recommendation tracking to both demonstrate the value of recommendation tracking and to improve our performance. I've worked with a number of medical informatics companies to develop technologies that will allow easier and more widespread application of recommendation tracking systems.
Awesome, and thank you so much for your time as well. And then I'll have our CEO, Adam Carell, introduce himself as well.
Hey, I'm Adam Carell, CEO of Within Health. I've been in digital health for about the last 12 years. I've been an entrepreneur, primarily focused on preventive health, really across different verticals, worked with providers, payers, large organizations, small organizations, really touched every area of healthcare and just focused on solving some of the issues that patients and providers have in today's healthcare world. So happy to be here.
Kick us off with our first question, and I'm going to target this one to Dr. Ben Wandtke. How big would you say the problem is of missed follow-up recommendations, and why is this a problem for practices?
Okay, so this is a big problem. Every institution across the country is dealing with this problem. Every quality leader has been struggling for years to try to tackle this one. Delayed in diagnosis is the real issue here. It's things that we identify, these incidental findings that are indeterminate for cancer, that a small percentage of these turn into cancers. And one of the problems is we find a lot of these in radiology. Recommendations are extremely common. Anywhere from about 5 to 20% of studies will have a radiology recommendation, depending upon the type of study that was performed. And as you say, about half of those recommendations never occur. And that's consistent across dozens and dozens of healthcare systems that I've worked with and talked to. So there's lots of recommendations. There's lots of them that are falling through the cracks. And there's lots of patients that are getting poor outcomes. They're being diagnosed with advanced stage cancers, stage 3 and 4 cancers that have very poor chances of beating the cancer, even with the best surgery and chemotherapies available. And a simple solution like identifying these recommendations, turning our unstructured radiology reports into actionable information, storing that in a database, and figuring out how to make these non-compliant patients compliant has been shown to really put a dent in this. We've been able to reduce the number of patients at risk for delay in diagnosis by upwards of 80–85% with recommendation tracking systems. And so that's this is a problem that everyone's facing, and it's a big problem. But with the right technology, people are finally starting to beat the problem.
Awesome, thank you. Adam, Dr. Kim, anything that you wanted to add to that, just overall the size of the problem and why this is something we're trying to solve for?
Sure, yeah, it's to us as a business and speaking with our customers, it's a huge issue on the quality side, which is obviously what healthcare providers care most about, but it also really affects their business from a financial perspective. These are patients that need these services to obviously get better and have better outcomes. But if a radiology clinic is missing out on patients that they can make money on, that's a big deal for them. And they need to worry about how they're going to keep their machines running and their lights on and their employees working so they can continue to provide care. So there's really a couple of aspects here, quality as well as business impact.
And if I can just chime in a little bit about the scope of the problem, I think sometimes people don't realize how bad we are at follow-up management as a specialty, as a field. So, for example, when for many years I used to cite this paper from JACR published back in 2014 that showed 71% of incidentally detected pulmonary nodules never get followed up. I mean, so if you think about it, almost more than 2/3 of the patients that we find some type of incidental pulmonary nodules don't get followed up, and that's a pretty scary statistics. Now, more recently, there have been a number of papers that are coming out that again highlight the importance of this particular issue. Just to share with you some of the more recent ones. For example, this month, there was an article in the JAMA that showed 1/3 of the patients don't receive timely follow-up after their CT lung cancer screening, which was published just this month. And then another article in the Journal of Breast Imaging showed that follow recommendation for breast imaging, and that was included in chest CT reports. They found out only 23% actually returned for follow-up breast imaging. So you can see that the failure rates that we're seeing in multiple different papers are ranging from 20, 30, 40%. So this is a big problem.
I guess I would ask another question off of that, Dr. Wandtke and Dr. Kim. What do you guys think the main reason for these patients falling through the cracks would be? Is it a communication issue? Is it that they don't care? Are they not being made aware? What would you say the main core of the problem is?
I guess I'll take first stab at that. Is there's a lot of people working independently. Patients are crossing, they're crossing from in-hospital care to out-of-hospital care. They're seen in ED settings, then inpatient settings. We do a lot of imaging in those settings. And then they're being sent out to the outpatient world. Outpatient offices, they don't have a lot of resources to work on quality improvement projects. In the last 10 or 15 years, there's been tremendous increase in the amount of effort and resources put to quality improvement in hospital settings. We've reduced the rates of procedurally related infections and other things dramatically, but there's been very little resources applied to the outpatient world. And that's where the problem really lies in this case, is that while the imaging findings occur in an inpatient setting, a lot of times the follow-up is required to happen in the outpatient setting. So there's a lot of steps of communication, whether the radiologist calls this to the ED doctor, whether the ED doctor includes the information in their discharge summary, whether they communicate it to the patient. And then even if you do all that, maybe the office doesn't have a great system to keep track of these incidental findings, and they just lose track of it, a year from now. So the entire system is set up to fail, which is why it fails so frequently. I'm honestly surprised that it works 50% of the time, and 30 to 50% of the time. But again, this is why somebody needs to keep track of this stuff, and whether it's your health system or your radiology department, there's a tremendous business case to do so.
Yeah, I agree with Ben with everything he said, and just to compound to that, problem is that as he mentioned, a significant percentage of the radiology reports contain follow recommendations. So for the sake of easy of math, if we say about 10% of radiology reports contain follow recommendations, and a health system that does, let's say, about 1 million studies a year, that's 100,000 studies a year that contain some type of follow recommendation that somebody needs to monitor. And so that is, just the sheer volume of it also is adding to the whole challenge.
While we're on this topic, Dr. Kim, how are organizations right now, or how are companies thinking about closing this follow-up loop? Like, what are some of the solutions that people are trying to string together here?
So I think one way to view this is by looking at the imaging value chain. So often in radiology, both those in academics and industry tend to focus mainly on the acquisition of images and interpretation of those images. Now, this is understandable since when you hear the term radiology, that's what most people think about. However, radiology is more than image acquisition and interpretation. The imaging value chain starts with the ordering provider placing an order. Then that exam has to be scheduled and protocol before acquisition and interpretation can happen. Afterward, there is the important component of communication back to the ordering providers, including the follow-up component. Now that I have briefly outlined the imaging value chain, I can share with you how different companies are approaching this problem of follow-up management. So from the ordering side, there are efforts through clinical decision support to guide the ordering providers to order the most appropriate exam. Now, this eventually leads to appropriate follow-up, so this is an important component. For those patients who are coming back for follow-up exams, scheduling becomes an important component of any follow-up program. From the radiologist side, companies work on using advanced technology, for example, by leveraging AI to determine who may be the best person to interpret a given exam in a timely manner. This can have downstream effect on the follow-up rates as well as the quality of those follow recommendations. Now, from the reporting side, reporting solutions of today promote a more organized way of documenting follow-up recommendations through the use of structured reporting. But I want to emphasize that they now go beyond simply structured reports. A modern-day reporting solution can also suggest at the time of interpretation the most appropriate follow recommendations based on the best evidence-based guidelines. Now, such assistance has been shown to provide not only more consistent recommendations among radiologists, but also those that have the right elements like modality and time interval information, which is very important when it comes to follow recommendations. And speaking of structured reporting, in fact, there is a JACR article this month on using smart elements from the structured report that can be used to trigger actions within the EMR. The authors of this particular article used incidental pancreatic lesions and found the patients with flag reports were more likely to get follow-up imaging. Now, using advanced natural language processing, NLP, there are products like Within Health that detect such follow-up recommendations from those radiology reports. Now, what makes Within Health unique is that it then takes that to the next step, which is to communicate those follow-up recommendations back to the patients.
Awesome, excellent. Dr. Wandtke, Adam, anything else that you want to add there as far as what organizations are doing to close this right now?
Yeah, I mean, I'd say most organizations are using labor. They're using brute force at this point. So they're able to get a list of recommendations, whether that's through some sort of structured reporting and manual flagging by radiologists or the use of AI and natural language processing, and they have some fairly rudimentary databases that are trying to keep track of this information. But after that, they're sort of left with this pile of stuff, and they're trying to figure out what to do with it. And right now, most people are making phone calls or stuffing letters manually, and that's a bit of a problem.
Yeah, and I'll just layer onto that. That's really what we hear from most of the groups that we speak to on a daily basis. To some extent, that's even a little bit more sophisticated than many of the groups. A lot of them really just don't have anything in place. There's a number of groups where they generate the radiology reports, send them out to a referring physician, potentially at another institution, and really their solution is to hope and pray they see that patient again in 6 months or a year, and really have no visibility into whether that patient went someplace else, ever was made aware of that recommendation, or did anything about it. So it's kind of a black box once that report goes out the door in many cases.
Yeah, I think a lot of that is related to, a lot of people thinking that, hey, within radiology, once I put the recommendation in the radiology report, my job is complete. I already made the recommendation. Now it's the responsibility of the ordering providers to read those recommendations and follow up on it. And I would say, part of that is true, but the reality is that, there are a lot of cracks in this, as Ben mentioned earlier. And, what I like to do is, sure, I can understand that, perspective from a radiologist perspective, because I'm a radiologist myself. And I can also see it from the ordering provider side of things as well. But I think if you take the perspective of a patient, if I were the patient and I got some kind of follow recommendation, then to be honest with you, I don't really care who helps me to get that follow recommendation, whether it's the radiology group or the ordering provider group. But at the end of the day, I want to make sure that I get my follow recommendation and it doesn't get, slip through the cracks. So I think that's why I think we need to have a sort of a paradigm shift, that this is an opportunity for radiologists as a group to provide, greater value back to the overall, care paradigm coordination, where, we can partake in that overall patient care by, saying, hey, you know what, we made a recommendation and the patient didn't come back. And our tracking system has shown that, this patient should really come back to us unless you think otherwise. And I think that type of care coordination would eventually help the patients. And I think that is the ultimate goal.
Yeah, I think you nailed it. I think it's the concept of patient-centric care coordination. And I think unfortunately today the problem is that the person who cares the most about the patient is typically the patient, but they're not necessarily well enough equipped to navigate today's healthcare system. And sometimes they're not made aware of what they need to do or know how to do it. And I think if we can give them a better way or method or potentially a way to hold their hand through it, it'll make for better outcomes and more comfortability for patients too, I think.
So thinking of future solutions and tools like Within Health, as well as competitors that are out there, Dr. Kim, what are some challenges that you can think of using AI or natural language processing in these tools and how to overcome them?
So over the last several years, I've seen a tremendous amount of advancement in the area of natural language processing, mostly thanks to the advancement in neural networks. And I'm sure you've heard stories of, AI writing stories and articles. But even with advancement, there are challenges when it comes to using computers to extract and track follow-up recommendations from radiology reports. You think it'd be easy just to, pick up the words follow up and recommendation from the radiology reports, but the reality is far different. Believe it or not, there are many ways a radiologist can say follow up is recommended. And some phrases are very specific to that one site. Often, follow recommendations are vague, which we call hedging in radiology. And it's something all radiologists do, including me, but makes it very difficult for natural language processing. Now, some may miss time intervals or modality information in their recommendations, making the follow recommendations, less actionable. And radiologists may make more than one recommendation in a given report, which is also quite challenging for NLP. Now, sites have tried to use standard language or macros in their reports, but often it is very difficult to have every radiologist in a group comply with that type of standardization. Now, I have read a ton of reports from the montage days from many, many different sites, and I can tell you the variability that exists within radiology reports is very high. So these are just some of the reasons why NLP in radiology or clinical text in general is quite challenging.
Definitely. Anything you want to add there, Adam or Dr. Wandtke?
I trust Woojin in this area. He is the expert.
Definitely.
I definitely agree with that. And I'll confirm we've read our fair share of radiology reports as well. And it's very much an art form for radiologists. 10 different radiologists looking at the same thing, you're going to get 10 different reports from what we've seen. So you absolutely nailed it.
Dr. Kim, you had mentioned, some of the problems you run into when you're using AI or natural language processing. What are some of the potential solutions, or how do you address some of these concerns? How do you overcome them?
Yeah, so like I said, having read a ton of radiology reports, they're highly variable. And I can tell you that sometimes when I read the radiology report myself, because sometimes a particular report might get tagged and say, hey, this wasn't detected properly. I would read it, and even as a human reader, as a radiologist, I don't know what the particular report is trying to say. So when a human is having tough time understanding the radiology report, there's no way any AI, no matter how advanced it is going to figure it out. So there is a limitation to how much AI or NLP can do. I can tell you that. And also, you cannot expect every radiologist to conform to a particular style. Good luck with that. That's just not going to happen. People have tried even with structural reporting. Even the most basic form of structural reporting doesn't necessarily get adopted by everybody. So there are those kinds of challenges. But I think when it comes to follow-up management, one of the things that can be done on a more practical level is some level of standardization. And ACR, for example, has really pushed for standardization on how the follow recommendations are made, as well as the kind of data elements that are stored in a structured manner. Like Ben said, one of the reasons that other ologists might have a better chance of some of these things is because they have a lot of structured data elements. And we need that. And that's a much lower hanging fruit than trying to get an entire group to adopt structural reporting. But, some level of standardization is very important. The reason why our PACS, images when, could understand, images from different modality vendors is because we're using DICOM. Okay, and within the hospital, we use HL7. There are certain standards that we use, and they do definitely matter and help. And so we do need some standardization when it comes to follow recommendations. That will help the NLP part much, much easier, and all the tracking much easier. It just makes it easier for everybody. And just like that example that I gave you, that particular article that used, pancreatic lesion, with the structure, they call the smart element that are present within the radiology reports that get sent separately into the EMR. The second component of what I would say is that structured data elements now have to be communicated to the other systems. A lot of times, we're very siloed in medicine. So in radiology, whether it's the way we practice or the way we create solutions, is that, yes, we create a really cool solution, but we don't talk to each other. And that causes a problem, and it causes the problem that Ben mentioned at the very beginning of how every step within the care coordination is all disjointed. And so what we need is that connection between interoperability between different applications. So for example, if Within Health detects the follow recommendation, if people use standardized method of doing it, it will make the Within Health's job much easier and much more confident in its detections. And then when it does that, then Within Health can also communicate those information back to the other systems like the EMR, because let's face it, all the ordering providers like to live in their EMR. So no matter how cool the solution that you create, if they can't see it within their EMR, they're not going to use it. So that interactive, integration is a very important component as well. So when we have those two pieces solved, I think it would help a lot when it comes to some of the AI challenges that I mentioned.
Awesome. Thank you so much.
Can I make a quick comment on that question?
Yeah.
Of course.
Okay, so we're talking about the difficulty of natural language processing to read through unstructured radiology reports and how much variability there is in radiology reports. As somebody who's a quality improvement specialist and works very closely with other quality improvement leaders in radiology, when you hear the word variability, you think of error, mistakes, and a process that needs to be improved. Okay, so everyone in the quality improvement community really sees the value of structured reporting, because that creates these data elements that can funnel into medical informatics solutions, can be used to monitor and measure the effectiveness of any process. That being said, as somebody who has implemented this at a site with over 6 hospitals and over 75 radiologists, right now the culture is not ready to do that at scale. Most health systems are changing their culture towards structured reporting very slowly. And we're going to have to accept that. I think in radiology, the good note is, even with unstructured reports and the fact that NLP is challenging, the technology is still good enough to make a substantial impact in the problem of delayed diagnosis and recommendation follow-up. Even with that challenge, these tools have been proven to be effective enough that I think it's the right time to dive in. You don't need to wait for the culture to change and your structured reporting solutions to be embedded and consistently applied by your radiologist before you can really have a change, make a difference to a lot of patients' lives. and before you can bring in a lot more revenue into your system. We talked a little bit, Adam did, about the business case for using a recommendation tracking solution. The amount of new examinations that you can bring in can pay for the cost of any technology 3 or 4-fold in most institutions. If you have a halfway decent system and you're not using 6 or 7 people physically to make phone calls and stuff letters, you're going to bring in so much more revenue than you're going to spend on this project, while improving the outcomes with the technology that exists today, even with those limitations we talked about.
Yeah, so no, Ben brings up a very good point. I wanted to emphasize that, yeah, don't wait until the AI is quote unquote perfect, or, we have a standardization. You're gonna be waiting a really, really long time for either of those things to happen. I agree with you. So for example, that example I gave you, a health system that does 1 million studies a year and about 100,000 studies would have follow recommendation. Well, guess what? Even if the NLP is only 90% accurate, that's 90,000 studies that you are going to be able to analyze and track that you could not otherwise do manually. So I definitely recommend, please don't wait. This is a very important problem, and there are solutions that are out there that can definitely help you tackle this at a more manageable level. So definitely look into those solutions and definitely tackle this problem today.
All right, this is a question that's open to anyone who wants to take a stab at it, but what are some of the current gaps in the market that you're noticing in general? Just overall, where can there be, a better solution plugged in?
Sure, I guess I'll start. For us, there's a number of people in the market that are working on NLP tools. Some are better than others to identify these recommendations in an automated format. This is very helpful. These are things that are very hard to create in most health systems. They don't have the data scientists to create these algorithms and test them. So having those available is great. The database to store the tools. There are a few sites that there are a few places that have decent databases. This is simpler technology, but where there's a big gap is a lot of people are trying to use the EMR-based databases, and they are really, really weak. And that really hinders people's ability to leverage even a human to take that information, which is quote unquote actionable, and actually get value out of that. So having the right database technology helps, and there's only a few people that do that well, and Within Health is one of them. But where Within Health really thrives, and where the biggest gaps are, in my experience, is the last mile. As a quality community, we don't really know how best to interact with our patients and our referring providers to flip patients who are either non-compliant or at risk for delay in diagnosis into compliant patients who have obtained their imaging test. It's a bit of a black box still, and to do research on that, I've done this a number of times through a number of grants, is challenging because it takes a long time to try to figure this out. Within Health, by going directly to the patients, has the ability to do what internet companies call A/B testing, where they can look at the messaging. What is the content of the message? What is the timing of the message? And look at the data about the efficacy of those messages, and change that in a much more rapid time frame that aligns with the quality improvement methodology of a PDSA cycle, where you're iteratively improving how you're doing things. It is very challenging to do that outside of this type of technology, and I honestly think that's one of the biggest gaps is we haven't come to consensus about what is success and what is a cost-effective way to achieve those results. So I'm really looking forward to working Within Health in particular, and seeing what the others in the industry do in order to tackle that last mile.
Definitely, great points. Anything that either of you would like to add, Adam or Dr. Kim?
To second what Ben was saying, I think the part that the Within Health plays that's important is that last component where you make that follow recommendations and communicate that to the patients. And understandably, a lot of us, those are in radiology, both as from a organization perspective and also from a company perspective. a lot of our products don't necessarily interact with the patients directly, because as radiologists, very few of us actually have, direct contact with the patients. If we do, some of us, like in, women's imaging, or, those of us who are doing procedures, sure, we do have, some quite a bit of, patient interactions. But other than, some of those areas, a lot of us don't, could go days without seeing, having a direct interaction with the patients. And so because of that, I think, we are definitely lacking in that area. And sure, and also, there are challenges related to the fact that, a lot of ordering providers don't want us radiologists interacting directly with their, patients without going through them first. So, with those challenges, but the thing is, I think we have to think about is that how do we get that follow recommendation information notification to the patients? And that's where I think the Within Health, plays an important role. So as long as, say a group of ordering providers and the radiologists agree on the best way to communicate to their patients to make sure that they don't, slip through the cracks, I think, Within Health provides that nice safety net for those patients and for everybody involved really in the care paradigm. To allow that patient to come back for their follow-up recommendation. So I think that's the part where Within Health plays, which I think is very important when it comes to this. And I mean, let's face it. For example, when I have a dentist appointment, I like the fact that it tells me a week before, hey, by the way, you got a dental appointment next week. Say whether you're gonna show up or not. Confirm or if you want to reschedule, please let us know. And then I will get the same kind of, reminder the day of. And I like those reminders. It makes sure that, oh yeah, I have a dentist appointment. And I think a lot of us, would appreciate that as patients within the medical imaging world as well.
Awesome. We've done a lot of talk as far as, the solution, the problems, how we can, make a difference here. Adam, I want to pass it over to you a little bit to talk about what makes Within Health different from the other solutions that are out there. What's our differentiator?
So I would have to say the biggest difference between Within Health and these other solutions is what we call the so what. I think there are a lot of solutions out there that are very good at using natural language processing or allowing physicians to tag when there is a recommendation present or identifying a disease. And we see a lot of companies doing image interpretation, but ultimately none of it really matters unless you can get the patient or the physician to take an action and work towards a better clinical outcome. And that's where we sit. It's the so what. So what if you have all this information, what do you do with it? And that's what we do. We take this information and we use it to send messages to patients, send messages to physicians, optimize the way we're communicating with these people to ensure that they're going to go and take that action at the appropriate time and with the appropriate next step. I don't think anyone else is really doing it that way today. And so far it's successful. We're seeing patients scheduling follow-up appointments when they've been kind of MIA over the last year or so. And they're coming back and taking necessary clinical actions. And hopefully that's going to translate to better outcomes for them or early detection of disease or something that makes their lives better. And that's what we're doing.
All right. And this is, again, an open question for anyone here, but where can this go, right? Is there applications of this outside of radiology? How else can you, verticalize it within the radiology department itself? Just overall visions for potential here.
I'll jump in on that one first. I think as CEO of Within Health, we definitely see this as a much larger play. I don't think these are particularly radiology specific issues. I think radiology is an incredible place to start because it tends to have a vantage point over the rest of healthcare. And most patients' healthcare journeys often start in radiology, right? Something's bothering you, you go to your primary care doctor, they recommend imaging as a next step. And that's really where you determine what's going to happen downstream. Is it cardiology issue? Is it oncology, orthopedics, whatever it may be? But radiology tends to be the starting point. That being said, there are issues with follow-ups across the board. Pulmonology, cardiology, laboratory medicine, and pathology is a big deal too. Seeing reports that come back with irregularities, and no one follows up on them. So we can definitely apply what we're doing in radiology to other healthcare verticals, especially the way that we've built the platform. It's not really a radiology specific tool. We're taking triggers that we find in healthcare medical text and translating those to responses or actions that we can drive patients and providers to. So being able to do that in other areas is something that we're able to do.
Dr. Wandtke or Dr. Kim, what vision do you have for Within Health, and where do you think it can apply?
Sure, I think I can help with this one. So, we developed we developed a recommendation tracking solution back in 2015, 16. And I'll tell you, from our health system perspective, it was a problem they've been trying to deal with for 4 or 5 years at least. And as soon as we finished our early version of our system, the first question that came to me is, can you do this for pathology? And then before you know it, I got, hey, we don't have great follow-up rates with colon cancer screening and colonoscopies. We have an issue with breast cancer screening and mammographies. And now today, our big ticket item is lung cancer screening. We've got tens of thousands of patients going through these screening programs, getting laboratory test results, and we have no really coordinated systems to make sure that the patients are coming back. So I think screening is of other imaging tests, and colonoscopy is way at the top of the list. I think from a laboratory perspective, there's about 10 times as many lab tests being done as there are diagnostic imaging tests being done. The volume is huge, and fortunately, there is structured data in that area. These are discrete data elements, so it'd be a little easier to even do something in that area. But I'm not aware of any products that do that. Our institution is not, and those are definitely areas of need. And on the last point, I think Adam touched on this maybe earlier, is that it needs to be easier for patients. We need to not only let them know that these studies are out there, but we need to help them interact with our scheduling systems in an easy way. They should have digital scheduling. They should have ways to see what slots are available that fit with their schedule, so that with a click of a button on their phone, not only do they get the alert, but they can follow up and get a study and get a time for their test and get it scheduled in a time that fits their schedule, which is, if that's available, I got to think, one, you're going to make patients happier, and two, you're going to increase your compliance rates of patients coming back, which is the whole goal here. So, there's a lot of opportunity for growth outside of radiology and within.
Awesome.
So I would say, yeah, as I've said before, I think one of the strengths of Within Health is that part where it takes those recommendations and communicate back to the patients. Really having that patient-centric sort of approach and view, I think is a strength within health. And so I do think, yeah, just like the dentist appointment example I gave you, I appreciate that, and that's why I continue to go back to that particular dentist. And yet, in contrast, I can tell you there are a number of different doctor's offices where I live that I would not be going back because they are really, really bad at follow-up. And so as a patient, this matters. And so, and this is not just in radiology, and these are other doctor's offices are not, medical imaging related. And, that actually impacts how I perceive that practice. They may be very good at what they do, but because of this, my view of them is now not as good, and to the point where I will probably look for other doctor's offices. And so I think this is a very important component. And this is why I think, Within Health can definitely grow beyond radiology in other ologies for sure. And this is a problem that every specialty faces. And I'm sure, those particular doctor's offices, if they heard my particular comment and complaint, they would love to have a solution that you guys can provide to make sure this doesn't happen to their, other patients. So that's, one thing I would definitely say, that yes, there's a huge amount of potential outside of radiology, huge market.
Great. Thank you both so much.